Are you going to introduce me?
Yeah, I'm just going to wait for a couple seconds. So hi, everyone. We're just going to wait for, just a minute or two to get everybody logged on, and then we will start with our presentation. Hope everybody's doing well today.
Hi, everybody.
So if you just got in, we're just going to wait for a minute and just get a couple more people going to come in, and then we'll get started. Hope everybody's doing well and have been enjoying this week and this beautiful weather outside. All right, Eric, you ready to get started?
Yeah.
All right, so thanks everyone once again for joining us today on our third day of webinar week for Kawartha Care Wellness Center. We had a great number of people join in on Monday for our ergonomics session, and we had a great successful session yesterday on carpal tunnel as well. Today we're going to be talking about a topic that's near and dear to most people's heart, unfortunately, because they've experienced pain in this area. It's also the #1 reason that people go to see their doctor. And it's one of the top prescriptions, pain prescriptions that people get due to this area, and why, and because it's always sort of injured or, in some sort of pain or inflammation. So we thought it would be an awesome topic to talk about. It's something that we see at clinic quite a bit as well. And it's something that, again, we'd like to provide you more information for. So before I get started, I'd like to introduce our panelist today, Eric. Eric is a massage therapist at Kawartha Care Wellness Center, as well as another clinic in Coburg. And he's been practicing for 2.5 years. He has a large array of experience with a number of different conditions in the short period of time that he has been practicing. We have seen him grow from a relatively new RMT to a superstar RMT, and we're very lucky to have him at the clinic. And he's going to be talking again about a topic that is also something that he sees quite a bit. So without further ado, I'm going to introduce Eric to take over. And before I do, I just want to say one small thing. If you do have questions throughout the presentation, we will be answering them towards the end. So you can leave them in the Q&A section right below. If you have something that you want to chat about throughout the presentation, we might be asking some questions, and you can answer those questions in the chat box as well. Or if you need to chat with one another during the presentation, you can do that at that time. It is automatically muted, so nothing to worry about there. And again, without further ado, I will hand this over to our panelist today, Eric, who's going to teach us about something that we all need to know, and unfortunately, we all have had some experience with. So take it away, Eric.
Hi, everybody. So today we'll be talking about lower back pain, some of the main reasons of why we get lower back pain, and what you can do to help prevent the low back pain from coming back, or help treat the low back pain that you're currently experiencing. So today what we will be doing, our agenda today, will be we'll be talking about what is low back pain, what low back muscle strains or tension are considered to be. We'll go through some basic anatomy and pathology of low back pain, and then we're going to also talk about piriformis syndrome or sciatic pain, because you really can't talk about low back pain without talking about piriformis syndrome. And we'll go into the anatomy and pathology of that specific problem as well. And then we'll dive into some treatments and exercises for both low back pain and piriformis syndrome. And then obviously our Q&A afterwards.
So type in the chat why if you've ever experienced a low back pain.
All right, so low back pain is considered to be acute or chronic pain around the lumbar spine and sacrum area due to either high muscle tension in the surrounding muscles or a specific muscle around the lumbar spine was actually sprained or pulled. So that's what low back pain is considered to be. Obviously, up on the screen, there's a lot more muscles in the back than what we'll be covering today. But for today, the four main muscles that we'll be talking about is the latissimus dorsi, which is one of the biggest back muscles that we have. So what it mainly does is, even though it's a back muscle, it actually mainly moves our shoulders. So if we put our arms up above our head like this, and then the motion of moving the entire arm down back beside us, that's what the latissimus dorsi does. The thoracolumbar fascia isn't a muscle necessarily, but it is a big part of the low back, and it attaches the latissimus dorsi to our sacrum and lumbar spine. The erector spinae is actually a group of muscles, a group of 3 muscles that helps us sit up straight or walks straight up. So if everybody in their seats just sits up as straight as they can, that would be firing your erector spinae muscles. And then the quadratus lumborum is in between our last couple of ribs in our rib cage, and then it attaches onto our upper hip area, and that allows us to bend side to side. It's also known as our hip hiker muscle, and it helps stabilizes our hip as we walk. So low back, what is a low back muscle strain, or what is low back muscle tension? So straining a muscle is where the muscle fiber are either overstretched or actually tear due to overuse, which is repetitive strain injuries, improper use. So if you lift something heavy where you really should be using your legs instead of your back, that's a common problem. And then fatigue, you can actually injure the muscles if you just overwork the muscles to the point where they just can't do anything else but just give out on you. And then what muscle tension is that tight muscles occurs when the brain continually stimulates a muscle to contract. And that makes it harder for the muscle to relax again, even when the brain has stopped telling it to contract. And this can be caused by stress. It can be caused by postural disorders, high amounts of caffeine. So having 3 cups of coffee a day may not be good for your muscles. And it can also be caused due to psychological disorders.
I bet a lot of people are feeling a lot of that in their neck and shoulders as well right now.
Yeah, I know I am.
Yeah.
So some risk factors for this would be being 30 to 50 years old, that's usually when we see it happen. It affects males more than females because males are usually a bit more labor intensive jobs. Also, males work harder than females. Haha, to my coworker who may or may not have said something yesterday in their presentation.
I don't
So,
agree with that. If you think no, put N in the chat box.
for those of you who don't know what I'm talking about, one of my coworkers said the exact opposite, and I'm just throwing a little bit. Um, Also, just some prior low back injuries. Core trunk muscle deconditioning. So if your core muscles, so abdomen and some of the other surrounding muscles of the back are weak, then that can also cause, make you more susceptible to injury. And then sudden unguarded movement, which is what we consider lifting things all of a sudden, but using muscles that really aren't meant to be lifting that type of weight. So some general testing that we would do in the clinic to kind of see like what's going on is we would always first start out with active range of motion and active resisted ranges of motion just to see how the muscles contract. So we would go through flexion with you, so bending of the trunk, extension, which is just leaning back, lateral flexion, which is just bending side to side, and then rotation of the trunk as well. And the various degrees here are all what's considered to be normal ranges of motion. So if you aren't reaching that that level of degree with any of those motions, that might tell us that there might be something wrong going on with the muscles. And then, you know, we do a couple other tests. The lumbar quadrant test is just another way of doing active range of motion, but it's just kind of testing how the back bends to the side while also extending. And then both Milgram's and straight leg raise test are both kind of just active tests to see how the muscles contract. And if there's pain with those contractions, then that might tell us that there's a strain going on somewhere in the back. So you have a low back injury, whether it's strain or tension, what can you do for it? Well, the best thing to do when it first happens is price, which is protect the area, rest the area, ice the area, compress it if possible, and elevate the area if possible. This is mainly when you first have it in the first 4 to 7 days of the injury. And then after that, when you're in the subacute and chronic phase of the injury, short-term physical labor restrictions might be recommended. Consider a TENS machine. If you don't know what TENS means, it's transcutaneous electrical nerve stimulation. And you can buy a machine for that at any drugstore. It's fairly safe to use. All it does is it sends an electrical impulse through the muscle just to help it kind of reset. And then an alkaline diet is sometimes recommended just to help rebalance the body's pH. So stay away from acidic foods. Stretch and mobilize the tight muscles, get everything moving just to make the muscles more malleable. And massage can also help during any and all stages of the healing process. Some stretches you can do for the low back muscles that we previously talked about would be trying to stretch out the latissimus dorsi which you can go up to any wall, put your arms above your head and just kind of lean against the wall. Also, because I'm on the ground, what you can also do is child's pose, which hopefully you can see me in this, but basically you just crouch down, put your arms in front of you, and you just feel a nice stretch right here. So that's something you can do for the latissimus dorsi. And then for the quadratus lumborum, you can do side trunk bends. So just something like this, doing it on both sides, you feel a good stretch right here. And that's getting the QL. Okay, so that's just some things that you can do to help treat it.
And would you recommend doing these on both sides, Eric?
Yes, I would. Always do it on both sides. So some things that you can do to help prevent injuries of the lower back muscles would always use correct lifting posture. If you're going to help someone move out, then always lift with the legs, keeping the back straight instead of using the back to lift heavy objects. Strengthening the core by doing some basic back extension exercises, leg lifts or sit-ups, or also planking. That can help strengthen the core. And the basic recommendations would be to do 3 sets of 10 reps every other day. You don't want to do it every day because you do want to give the muscles time to just rest and heal back up after you work them out. And then you can also just try standing up for 5 to 10 minutes after sitting for long periods of time. Long periods of time is usually considered 1 to 1.5 to 2 hours of sitting. And also just walking for 30 to 60 minutes every day can also help prevent low back pain. So now we're going to talk about piriformis syndrome. So what piriformis syndrome is when the sciatic nerve, which is the biggest nerve in the human body, gets compressed or irritated by a myofascial trigger point or just general muscle tightness in the piriformis muscle itself, which is surrounding the nerve, which is shown in the picture. Now, with this picture and later slide, we'll go into deviations of how this is anatomically set up. But about 80% of people have it where the sciatic nerve is just passing by the piriformis. Also, if you don't know what a trigger point is it is just a sensitive area of muscle with a palpable nodule in it. Palpable meaning it's noticeable. You notice kind of a lump in there that's kind of painful to touch, and if it's painful when it's compressed, it can also cause tenderness and pain and motor dysfunction in the surrounding area. Okay. So some of the muscles that's going on around the piriformis and just the posterior gluteal region in general is first and foremost gluteus maximus, our big main glute muscle. It's also known as the biggest muscle in the human body. And what it really does is hip extension. If you don't know what hip extension is, it is basically just lifting the leg up like that, or when you're walking, just bringing it back like that. And then gluteus medius is uh, just above glute max, and it helps with hip abduction. It's known as the deltoid of the hip. Um, and glute minimus is kind of in between glute med and glute max, and it also helps with hip abduction. Hip abduction would be to just lift the leg up in the air if you're lying on the ground, or it would just be bringing the leg out away from the body if you're standing up. And then lastly, well, not lastly, but one of the last big muscles in the posterior gluteal region would be the piriformis. The piriformis helps us laterally rotate the the thigh. So if you look at your leg and you just want to point your toes out away from your midline or away from your belly button, then that is what lateral rotation is. And then, you know, some minor muscles that we have in the gluteal region would be the superior and inferior gemellus, the obturator internus, and quadratus femoris, which all help the piriformis do that one lateral rotation.
So this is the most sedentary our population has been since we've all been quarantined with coronavirus. So I'm wondering, out of the group here and the participants that we have, if you could just maybe type into the chat box and let me know if any of you have felt low back pain or sciatic type symptoms at all. You can just type in Y or yes in the chat box.
Okay, so a little bit more about the piriformis syndrome pathology would be that muscle tension and myofascial trigger points in this muscle can irritate the sciatic nerve root, which causes the symptoms along the path of the nerve, which the path of the nerve is down the back of the leg into the thigh and a little bit into the calf. Symptoms of this includes pain, numbness, and tingling. With that being said, like I said when I first introduced piriformis syndrome, 80% of the population has the nerve root just passing alongside the piriformis muscle. About 1 in 10 people have it where one branch of the nerve is passing beside the muscle, and then another branch is actually going through the muscle itself. About 2 to 3% of the pop have it where one branch is going under and the other branch is going over the muscle itself. And then 1 or less than 1% of the population has it where both branches of the nerve just going directly through the piriformis muscle. And considering the fact that the sciatic nerve root is as thick as your pinky finger, being about 8 millimeters to 15 millimeters wide, it's a pretty thick muscle to have go through. I mean, it's a pretty thick nerve to have go through a muscle. So risk factors for this would be people ages 30 to 40. That's usually the predominant time people get sciatic pain. It affects females more than males. Trauma to the area can also predispose you to having piriformis syndrome. The major thing right now, though, is sitting, sleeping, and driving in one position for long periods of time. And then also genetic variations of where the nerve sits can also predispose you to getting this pain. So just some quick tests that we do. The two main tests that I really do in my practice would be the piriformis stretch test and piriformis muscle test. The stretch test, we basically do it to see how the muscle moves and if it's restricted or if there's pain with just a good stretch of the muscle. That could tell us that it might be piriformis syndrome. And then the piriformis muscle test, just seeing how the muscle contracts, how it works, and if it's contracting but there's a lot of pain with the contraction, or if there's a weakness with the contraction of the muscle, that might tell us a little bit more about what's going on in the gluteal region concerning the piriformis. So if we go to the next slide. So some treatment and exercises that you can do for the piriformis syndrome, and just if you have the muscle being tight in general, is if it's inflamed, then ice it, and that'll help just reduce some of the inflammation going on in the area. And then after the acute intense pain has subsided, you can start applying heat to reduce the muscle tension. And then again, consider a TENS machine. Potentially, if nothing else works for you, then try short-term use of any non-steroid anti-inflammatory drugs, which is Tylenol, Advil, ibuprofen. That can help for short-term, but don't use it every single day. Some stretches that you can do, which you can hold for 15 to 30 seconds, doing it 1 to 2 times a day, would be the pigeon pose, which is shown quite well in the picture on the slide. I'm not as flexible as the person shown in the picture, but I'll definitely try to give you an example of it as Manju explains what I'm doing.
So just like in the picture, Eric's going to be doing both sides, so stretch them out, bringing the left leg forward, just like, and with the knee forward as well. His right back leg is extended as far as it can go, so as straight as it could be. And he is using his palms on the floor and just looking straight ahead. And then he would do the exact same thing on the opposing side. Even if one side's hurting and the other one's not, we always recommend both for balance. So using the right side, bringing the knee up, bringing the left leg straight and back, and then of course, using the palms on the floor to look straight and stabilize.
Yeah. And then if you don't want to do that, if you don't like getting on the ground, or if you just find that being hard, then in a seated position, what you can do is go into a figure 4 position, which is just bringing the leg that you want to stretch above, and then leaning forward, and you'll feel a good stretch right here. Okay, and then some strengthening exercises that you can do is front kick-ups. So what a front kick-up is on the ground. What you'll do, the side that you want to work out, well, work out both sides as we just discussed, but just bring the foot in front of you as much as possible and then lift the leg up in the air, just like that. And do that for 3 sets of 10 reps every other day.
Perfect.
Okay, so the gluteus medius muscle is something that I also wanted to touch on, because honestly, I didn't know where to put this slide because it's kind of a part of the lower back pain problem, but it's also just the hip area. So that's why I'm giving it its own attention and its own slide. So the gluteus medius is a huge culprit in giving people low back pain, even though the pain is truly coming from the posterior hip region. And that's just because of its myofascial trigger point referral pattern, which is shown in the picture. Um, yeah, it just kind of goes right along the waistband. Risk factors for getting this muscle really tight would be, again, sitting or sleeping in one position for long periods of time, which can damage the muscle due to entropy, having the muscle just kind of lose strength due to not being used a lot. But on the other side of things, if you're using it a lot, and just giving it some repetitive uh, repetitive stress with hip extension exercises, say you're on the ice for long periods of time skating, that can also make the gluteus medius really tight. Stretches, again, that figure four position that we just went over, and then strengthening exercises, which is side kick-ups. Like the piriformis, where we did front kick-ups, it's similar, but side kick-ups is also known as clamshells, which is just lifting the legs straight up in the air when lying on your side like this. So doing that for 3 sets of 10 reps every other day is help. Again, do it on both sides, and then with the stretches, do it 1 to 2 times every day for 30 seconds at least, or 15 to 30. Cool. Some preventative measures that you can take to help reduce both sciatic pain and tension in the gluteus medius is avoid sitting for long bouts of time. Regularly stretch for at least 30 seconds, and get at least 30 minutes of physical activity a day just to get the muscles moving, get the joints moving, and stuff like that. And also, if you can, and if you have the time during the beginning of your day, try doing some basic warm-up routines of a couple stretches and a couple exercises right when you're rolling out of bed just to get the body moving. So thank you very much for joining us. Just remember to don't sit without getting up or moving every hour and hour and a half. If there is tension in a muscle, the best thing to do is really to stretch it out. Stretching on both sides. Use ice if the pain just arrived and it's intense pain. And then after the pain has kind of subsided into the dull and aching stage, then start using heat to help reduce muscle tension, and always use proper lifting techniques. Thank you.
Awesome. Thanks, guys. So I wanted to also say thank you to Eric for putting together this presentation and being able to educate us on a lot of awesome stretches and a lot of simple recommendations that we can do during this time where we're not able to follow our normal routine to see our therapist. And so going back to what we said, again, good takeaways. We will be sending this webinar out, so you do have a reference to all the stretches that Eric has come up with for the low back and the sciatic area, and also, again, the recommendations that he's provided. So if we have any questions at this time, you can leave them in the Q&A box. I know a lot of people in the chat had been agreeing that yes, low back pain is definitely there for them. So that's something that obviously, you know, hopefully this presentation helped you with. So I don't have any questions right now. You can keep typing if you do. So I just wanted to touch base and let you know that we are still offering chiropractic and physiotherapy appointments at the clinic. We can do them virtually if it's not urgent care. We've been doing some new assessments that way. Or if you're a patient with us and you want to continue your care and not let it get to a point where, you know, it's really, really bad and debilitating, then we can see you virtually, and it'd be a simple call like this, and we would go through an assessment as well as treatment with you. We've had a lot of success with that. Second to that, if you are an urgent care patient, so your pain is more than a 7 out of 10, or you're thinking of going to the hospital, or you're taking medication for lengthy periods of time and it's still not working, we can see you in the clinic. And we're using proper safety protocol right now to have patients in for chiro and physio. Unfortunately, not massage quite yet. And I wanted to talk a little bit about the upcoming free webinar. So this webinar week has been a great success. And so we are on day 3. We talked about ergonomics the first day. We talked about carpal tunnel yesterday and low back pain today. Most of these topics are what we see frequently in clinic. Tomorrow, Dr. Jillian Edgar will be talking about hip pain plus pregnancy and hip pain. And going through a lot of information there that will be fun and exciting. And also on Friday, Ryan will be talking about how to reverse the effects of bad posture. So both really relevant and things that you as our patients have requested. So if you do want to register for any of these, they are free. They're at 3 o'clock on Thursday and Friday, and you can sign up. You can either contact us and we can get you signed up, or you can go to our social media page and there's a link there to sign up. Last but not least, I think Eric echoes this as well. We do miss our patients dearly and we can't get back to work yet, but we wish we could, and it will come in due time. But if you do have any questions or concerns, or you are experiencing any of these symptoms, just give us a call, text us from our website, or even email us, and we can hopefully help you out there as to what the next step is, or the recommendations that you should do at home with what you have. But yeah, that's sort of the end of our presentation. We, again, thank you so much for joining us. Thank you, Eric, once again. And we hope to see you guys tomorrow and Friday, and hope to see you all soon. Bye-bye.
Bye.
Good job, Eric. That was awesome.
Okay, cool.
I'm gonna close this now, okay?
All right, later. Also.
Okay. One second, actually. Let me just stop the recording.
Okay, it was recording.